Hi, I'm Dr. G.V. Chaitanya Rao, your sinus doctor. As a sinus specialist, I've done more than 10,000 nose and sinus surgeries to date. I keep interacting with patients who have nose and sinus issues on a daily basis. I see that many of my patients have the same kind of misconceptions about nose and sinus surgery. Today, in this video, let me debunk these myths about the sinus surgery. Let me talk about the first myth. Is sinus surgery very invasive? No, sinus surgery is not invasive. The sinus surgery is done through an endoscope. So, there are no marks or cuts on the outside of your nose or face, and the shape of your nose remains exactly the same even after the nose and sinus surgery. So, let me talk about the myth number 2. Should we take a long leave of absence after nose and sinus surgery? That is completely untrue. I advise my patients to return back to the office from the next day. They can drive their motorbike or car from the next day itself on their own. They can do normal activities at a slow to normal pace from the next day itself. We advised our patients to stay away from doing strenuous activities or participating in heavy workouts like lifting weights. Short walks are alright. Let me now talk about the myth number 3. Will there be a change in the way I sense smell after nose and sinus surgery? No, that is not true again. After your nose and sinus surgery, your sense of smell may actually improve. See, the sense of smell is perceived by the area at the top of your nose here. When we do a nose and sinus surgery for you, we correct any physical obstructions there might be in your nose and sinuses. At the same time, once we do a sinus surgery and widely open up your sinuses, the inflammation in your nose and sinus comes down very much. And this helps in reaching of the air to the top of the nose easily, and your sense of smell should actually improve. It is very rare that we see patients complain of reduced sense of smell after surgery. There is an explanation to this also. The patients after the nose and sinus surgery experience nose congestion, and as a part of the healing, the skin inside the nose and sinuses swell up. But usually within a few weeks to maximum a month or a month and a half, their sense of smell should also improve. Let me now talk about another common myth. Sinus surgery is very risky. This is totally false. Sinus surgery is comparatively a very safe surgery. In my experience of having performed more than 10,000 nose and sinus surgeries, the risk or the complication rate of my surgeries is less than 0.3%. Some of my patients, when I suggest nose and sinus surgery for them, they get very worked up. They're very worried. And I can understand that. Going for surgery is not a simple thing. But when I meet these patients post-operatively in the ward, they are surprised. Some of the patients ask me, have you actually done a surgery for me? It's so simple. So I hope I have addressed some of the common misconceptions many of the patients have about nose and sinus surgeries. If you have been postponing your nose and sinus surgery for this reason, then please go ahead. Nose and sinus surgery, when done by an expert surgeon using good equipment, the chances of any risks or any complications is very rare. And you can return back to your work very soon, and there is no chance that you will lose your sense of smell. So if you still have any doubts about the sinus surgery, please feel free to comment in the comment section below, and I'll make sure that I reply to all your comments. Thank you so much and namaste.